generates a lot of revenue, or should we remove it? Now, these are Wharton students. These are still ostensibly open-minded, virtuous college students. 80% of the students said that they would keep the drug on the market, and 100% of them recommended that they expend more money to pressure the FDA to keep it on the market. That occurred that study took place in 1977 at Wharton College, which means that most of those people are it could be senior executives at a lot of the corporations that we're talking about today.
I have one word, Vioxx.
Yeah, certainly. But again, Merck paid $3 or $4 billion fund for the victims and survivors of this on a drug that they knew would kill a lot of people and generated $15 or $20 billion in revenue. So they lose $4 billion of their $20 billion in profits. That's a great business model, especially when you own and control the executive, legislative branches of government, large chunks of the judiciary, the regulators. You're paying off all the universities that are doing this bogus stuff and keeping quiet your stuff. I mean, if you're a university that accepts $50 million a year from the NIH and the pharmaceutical companies, what's the likelihood that one of your professors or you're going to allow one of your students to say, gee, this isn't right? Now, what would happen to that funding? The answer, of course, is what happened with Peter Duesberg. He got lots and lots of money from the NIH until he started questioning Robert Gallow's work with the initial stages of HIV and the correlation and causation. Overnight, I mean, this is the guy who mapped the genome of the retrovirus, and who Gallo says no one else on the planet knows more about retrovirology than Peter Duesberg. He would probably have a Nobel Prize today for his cancer research that is ongoing, but the NIH tried to quiet him. He refused to stay quiet, so they withdrew all of his funding.
Got it. Dr. Rima, I'd like to propose an alternative theory as to what the HIV virus is. I'm going to suggest that looking at it from the standpoint of genome disruption syndrome, your medical creation, we see that HIV is just basically likely to be sort of an opportunistic virus that is able to replicate fairly easily in the body of a person who's already genome disrupted. And that we're seeing really an expression of one of the things that happens when your genome is disrupted by those toxins that come in from the outside that we've discussed, the GMOs and the radiation and all the genomicidal technologies, that once that's happened and your body can no longer keep up with the damage, no longer repair its own DNA so the DNA can repair the body, and the whole thing begins to collapse into chronic disease.
It's entirely possible that you are correct. Certainly the opportunistic diseases are very, very, very much a part of something that doesn't seem to be caused by an organism. I lean, myself, toward a different hypothesis about what Clark's microscopists, electron microscopists, are seeing. And I'm not 100% sure that this is the hypothesis to which I subscribe, but it's certainly compelling, and that is, and I'd love to have your input, Clark, but the hypothesis toward which I am leaning currently is that these are debris bits that have been mistaken for viruses, that they are consistently found in many circumstances, but they are a commonplace finding unrelated to, not even related as closely as fire trucks to fires, not necessarily causally at all, but that they are adventitious findings that are not causal and not necessarily capable of true replication. That's not an unreasonable, I think, analysis of what people are finding on electron microscopy, so far as I know. Now, you probably have more up-to-date information information than I do. So I'd love your input on this, knowing that you're not a microscopist or a virologist, but you are up to your eye bones in this on a daily basis, and you're very bright and very committed to this area. So what do you think about that?
First of all, that assumes that HIV is pathogenic. There's no evidence that it is.
No, I'm saying I don't assume that it's pathogenic.
Okay, no.
I'm sorry. Go ahead.
Yeah. First of all the evidence that we've found, there's no evidence that HIV is pathogenic. Also, the fact that I said that HIV is found, we've been photographing it in blood for the last few months. What I failed to point out was that we spiked the blood with HIV. We actually took blood that had no HIV in it, and we put HIV in it to ensure that we could actually see HIV if it was present. So, and not only that, but the electron microscopists and the experts who we are working with, who've been photographing HIV since the 1980s, have never seen it in blood. In fact, they have told us that our experiments were the first time they ever saw HIV in human blood. So the only way HIV appears in the blood is if you spike it with HIV. It doesn't occur naturally anywhere, and it never has, and it never will.
Wow, so this is scam upon scam upon scam. This is scam layer cake.
Yes, it is. Now, the reason we're doing that experiment is because we want to know whether or not we'd be able to see HIV if it actually was in the blood. So for example, the orthodoxy, and you have to play along with the orthodoxy because they make these premises, they create these straw man arguments, and then you have to take apart the straw man one arm at a time. And so one of the assumptions is that you cannot see that HIV is non-detectable below 1 million viral load. So if that was true, then that would be a reason why we couldn't see HIV in blood below 1 million. Of course, that doesn't answer the question why we couldn't see HIV in 9 million. But what we want to do is we want to spike with less than 1 million. And we want to find it in less than 1 million, in amounts closer to maybe 5,000 or 10,000 viral load. And if we can prove that we can see HIV in that, then that debunks the claim by the orthodoxy that you can't see HIV under 1 million.
I want to put something else into the conversation in the very few minutes that we have left. The cauliflower mosaic virus, which is a promoter virus used intentionally in the genetic modification of plants and animals, causes the symptoms that we call HIV. So we are eating the cauliflower mosaic virus in food that cannot be labeled legally in the United States because it's genetically modified, and that must remain hidden according to the regulations of this country.
By the way, Dr. Rima, Hawaii has apparently just passed a GMO labeling law.
Excellent.
Back to you, sorry.
Excellent. Now, the point is that virtually every genetically modified organism carries the cauliflower mosaic virus, which in human beings destroys the CD4 cells, which in human beings destroys immune capacity, which in human beings is associated with Kaposi sarcoma and with the other opportunistic infections and diseases which characterize HIV. It is not HIV. It is GMO.
Wow. So back to GDS again. Exactly. Extraordinary. And by the way, folks, while we're talking about the news of the hour, report from the Seattle area, guard shoots at boy 15 at FDA office in Bothell, I guess Washington. Yes, those armed federal guards with their hollow point bullets are shooting at teenagers.
I think that's just wonderful. Clark, what do you think about this cauliflower mosaic hypothesis?
Well, I'm not familiar with cauliflower mosaic. However, we did a study on the testing technology called flow cytometry. God, all this alchemy. It's like trying to remember that Mercury's not orbiting the sun. It's actually in retrograde, and everybody knows that when Mercury's in retrograde, it's hard to communicate properly. So
it's in your teeth.
It's just remarkable stuff. But flow cytometry is the device that they use ostensibly to count CD4 cells.
Right.
Well, the CDC came up with this political decision that was completely arbitrary about how much CD4 cells you need in the human body. And if you have below a 200 CD4 count, ostensibly you're dying from AIDS. Now, one of our criminal defendants was a young, I think he was in his late 20s. He had a CD4 count of 7. And he was as healthy as an Olympic athlete. And that was our first clue that there was probably something wrong with flow cytometry. And with this whole notion that, and by the way, that trial, that was a settled case, and he's still alive. He's very healthy. He doesn't take any of the HIV drugs. He knows it's complete bunk, but he's allegedly HIV positive with a CD4 count of 7. How does that happen? Well, flow cytometry doesn't count. Well, there's a couple things. Number one, flow cytometry doesn't count these cells accurately. The technology is so poor that they undercount them. There's been something like 66 recalls on flow cytometry devices and components that miscount this stuff. Well, they undercount. When a flow cytometry device doesn't work, they undercount. But when they undercount, you can start ARV drugs sooner. Because, now he's HIV positive, so now we can start delivering these very expensive ARVs. So they are actually marketing flow cytometry devices that undercount in an effort to motivate people to buy them to use these so that they get more HIV victims and AIDS victims. So that's part of that. There's also no evidence that CD4 counts. Think of CD4. First of all, CD4 is what's called the Th2 response. AIDS is a Th1 problem. So it's kind of like using a sphygmometer to check how much protein you have in your urine.
Sphygmometer, by the way, folks, is the official name of the blood pressure device that is wrapped around your arm and pumped up to measure your blood pressure. So what Clark is saying is that using the wrong instrument is inevitably going to give you the wrong answer.
Right. So, and thank you. I'm sorry. So they're using the wrong testing. But even let's just say that CD4 is the proper way to gauge a Th1 response, immune response. Think of CD4 cells as policemen. Now, when you go to your local park, is the park safe or unsafe if there are no policemen around? There may be policemen around, there may not be policemen around, but policemen show up when there's a potential problem. According to Tony Fauci, who's the head of NIAID, he and a co-author in a series of reports said that less than 2% of all CD4 cells actually exist in the bloodstream. The rest of the time, they're not in the bloodstream. They're not deployed. So it's kind of like a rapid response force. When you have a little infection, you got some kind of pathogen, or you got some kinds of injury or something, all these CD4 cells rush out to not only identify what the problem is, but to respond to it, and to, the mitochondria, I guess, binds and poisons these pathogens with nitrous oxide, and kills these pathogens, and then it's flushed out in the blood and so forth. So basically, if you're healthy and you don't have an illness, you don't have an infection, you're not going to see CD4 cells any more than you're going to see policemen at a park where there's no crimes going on.
Now that's very interesting, because what you're really saying is that those people who are coming up with these with higher levels of the CD4 cells probably have chronic inflammation of some sort, and Dr. Rima, they're probably suffering from GDS.
Probably. So what you're saying is that everything is Alice in Wonderland inversions to create the desired outcome.
Depopulation. Dare we say the word, Dr. Rima?
Genocide. It's funny. I'm doing this story right now on the HIV vaccine in India, and that's killing children in India, and there's been reports in Vietnam and Bangladesh as well. And Gates is in charge of he's the permanent board member to the Global Alliance of Vaccines and Immunizations, Gavi, G-A-V-I. And Gavi claims that this meningitis kills an estimated 370,000 children worldwide each year, and that 20% of those deaths are in India alone. So you're talking, India has 1.2 billion people. 20% of 370,000 is 1 in 16,000 chance that you're going to be come down with this meningitis. Now, that may seem a lot, but if you compare with what the National Safety Council reports on these odds, 1 in 16,000 chance of dying from meningitis is somewhere between dying from exposure to natural heat and dying in a flood or catastrophic weather system. So the odds are astronomically. They're minute. They're almost non-existent. Now you compare the odds of being injured or killed by meningitis from influenza, and you compare that with what the National Safety Council reports as a 1 in 125 chance of being injured or killed from a toxin, you'll find that this is not unlike the reports that have been published about adverse drug reactions that claim that if these adverse drug reactions were tracked like real diseases, adverse drug reactions would rank as somewhere between the 4th and 6th leading cause of death in the United States.
Well,
So,
I have to take exception with that. Excuse me, Clark.
go ahead.
The American Medical Association, in its journal JAMA, Journal of the American Medical Association, published an article a couple of years ago in which they documented that properly used drugs in hospital alone in the United States were the leading cause of death. Properly used, this is not medical accidents, drugs that were used as they were indicated to be used according to the guidelines and the package inserts and so on. Those drugs were the leading cause of death in the United States. And when you add in all the out-of-hospital properly used drug deaths, you have a system, and I say it's a system, not an accident, that kills more people than cancer, cardiovascular disease, stroke, diabetes, and obesity combined. Now, it is no accident that intelligent people at the FDA and at the Drugs Board in Canada and so on, in drugs that are approved for unrestricted use are retired within 5 years. Drugs kill. And oh, by the way, parenthetically, psychiatric drugs, not guns, kill people. The United States population has been armed to the teeth since before there was a United States. Mass murders have only become commonplace once, well, aside from military mass murders, have only become commonplace once psychiatric drugs became commonplace. We are talking about profound levels of intentional mayhem.
Well, I was trying to be charitable.
Why?
Give the benefit. Well, I mean, let's just say.
We have 10 minutes left, folks. That's all. All right, go ahead.
If we were charitable, this would be a 1 in 126 chance of being injured. If I was being charitable, but and I'd like to see your documentation on that, because so that I can update my own documentation on what I have as well. The point I wanted to make is with Gavi, though, is that Bill Gates is in charge of. He's a permanent board member with UNICEF and the usual suspects, and the ostensible objective of Gavi is to save children's lives. But this is in complete contradiction by what Gates' stated objective was at that infamous TED presentation, where he said that today the world is 6.8 billion people, that's headed up to 9 billion. Now, if we do a really great job on vaccines, healthcare, and reproductive health services, we can lower that by 10 or 15%. That's roughly 680 million to 1 billion people. Now, his apologists, that's an outrageous statement. He wants to reduce the population by 680 to 1 billion people.
Using the healthcare system and vaccines.
Using vaccines in the healthcare system. Now, how? Aside from the fact or the question that I have no clue how somebody saves lives by killing people, Gates' apologists say that what he meant to say is that if you lower childhood mortality, people will have less kids and the rate goes down. That means that if you're Habib and Shaheen living in a village in a third world country, you are actually going to only have 2.2 children. If you decide, if you have vaccines, and if you want to prevent all this mortality, if the mortality rate is high, we're going to have lots of kids.
Well, wait a minute.
We're going to actively think about these things.
Wait a second. The mortality rate, well, those kids that die young never get to reproduce. They're not any part of any population growth.
But I mean, this is how convoluted these people who head up these international organizations that are affecting each one of our lives, that we are all paying for this. We are paying for the interference by the UN, by Agenda 21, to do this to Americans and people around the world.
That is correct. That is correct. And this, if I go back to an earlier statement I made, if anybody thinks this doesn't touch them, they don't understand the discussion.
Yeah.
Yes, Dr. Rima, that's really true. Well, we have about 8 minutes left in our allotted 2-hour recording period. And it's such an important series of discussions we've had. Some way to summarize, to help the people who've been listening without being able to make comments, because this is being pre-recorded. Of course, we will, when we broadcast this tomorrow, there will be a chat window open, and there'll be some comments, I'm sure, being made, and I'll be keeping up with them as best I can. It's been an extraordinary experience. We have been going down some interesting rabbit holes. Dr. Rima, where do you think it goes from here?
More rabbit holes.
More rabbit holes. We are getting ready for our fourth annual War Council. And in fact, if you go to one of our tiny URLs, tinyurl.com/war facebook.com/War Council 4. The number 4, War Council 4. You'll find a page where General Berg talks about the purposes of the War Council, and we have links to where it's going to be broadcast on the 24th of February, Sunday the 24th. We're going to have extraordinary guests. We are warming people up with guests like Clark Baker, and of course, Clark, we had Christine English on a while ago. She's the reporter from England who exposed the 50 children in Chad who have been left paralyzed by another one of the Gatesian vaccines. And of course, the response of the authorities to her exposure of what had happened was that to say that she made it all up. Sort of, what was it, Dr. Rima? Munchausen by proxy?
Yeah.
But she didn't cause the disease. It didn't exist, you see.
Yeah.
It's reverse Munchausen by proxy.
You know, I would like to know, Clark, what people can do when they are approached with the opportunity or requirement to be tested, and I use the word in quotes, for HIV/AIDS. What are their rights?
Well, it depends on the state that you're in and your healthcare insurer and so forth. What a lot of patients endure, especially low-income patients that are that the academia and the scientific and medical community look down their noses at as too stupid to understand. They'll often, during the initial intake, they have to sign a stack of forms because this person is wearing a white doctor's outfit. They can be trusted, of course, and so these really stupid people they target sign their name, and when they look at this, you got to look at every single thing, and it says we're going to do an HIV test, and so as soon as you authorize that, chances are you're going to get an HIV test, and if they're giving you drugs or vaccines, and these people don't have a clue. These experts have no clue on how to diagnose or treat HIV. They simply do these stupid tests, and the test comes back, and we're off to the races, and it's virtually impossible, even though we're working on it, it's virtually impossible once your name is on a local, state, or federal HIV registry. It has not yet been done to where they've actually removed the names from these registries. We're going to start working on that.
Awesome.
But the best thing you can do is avoid hospitals. Hospitals are the most dangerous place on the planet. I would recommend HSAs, health savings accounts. There's a wonderful organization where instead of you paying an insurance company that hires subcontracts or advises you to go to a hospital, you do an HSA where you stay healthy and you can bank what you're saving in your HSA, your health savings account. And then if you really do have to see a doctor, go see an integrative medicine doctor or a homeopath or somebody who uses things that don't kill or injure 2 to 4 million Americans every year. And if you have a broken hip or you need some kind of surgery that has to be done, go to an organization like Medibid, MEDIBID.com. The founder, Ralph, I can't remember his last name, and he's going to beat me up for not remembering his name. Ralph Weber. He not only sells these HSA accounts, but he also has created Medibid, which is kind of a Priceline.com, where patients who need services can find vetted clinicians all over the world who are not subjected to the medical standard of care in the United States. And so you can often get treatments by really good doctors in other countries that have a desire to attract America or the Western population's desire required to have good, healthy medical care. And so their model is based on providing good care to patients, whereas here locally in the United States, the model is, let's see how sick we can make this patient so that we can bleed these insurers and Medicare and Medicaid as much as we can. So the model used by Medibid and these HSAs can save the consumer. If I was 18 years old, I would invest in this right away. And you very quickly save a lot of money, and chances are you can pay. Chances are very good that you'll get much better quality care, and you'll get much higher quality treatment when you need it, and a more honest and knowledgeable physician when you need it than by walking into some clinic here in the United States.
Dr. Rima, the last minute of the program, of course, you're doing just that in Chile. But
exactly.
On to you, Dr. Rima, half a minute.
We are putting together and working very hard on it the Dr. Rima Institute for Health Advancement in Santiago, Chile, where the ways we want to treat people are quite legal and quite approved by the government. Quite a difference from the United States. We'll keep you posted. Looking forward to it, to having more to tell you. Clark, this has been a wonderful interview. It's always a pleasure to talk to you. You are knowledgeable, you are passionate, you are active, and you are accomplishing what needs to be accomplished. The Natural Solutions Foundation, organizationally, and I personally, and I know Ralph and General Burt, thank you for both your work and for your position as a colleague who will speak out and act out. And I salute that. Give your website one more time where people can.
Well, ladies and gentlemen, we have reached the end of the recording of Dr. Rima's interview with Clark Baker. We've also reached the end of our rebroadcast with Dr. Rima on Skype and Dr. Rima on the chat window. We will be back next Sunday with Dr. Rima Truth Reports.